We're here at this symposium to discuss how to treat diabetes within the setting of cardiovascular disease. I'm focusing on combination therapy, exploiting the pleiotropic effects of drugs that were designed to treat insulin resistance as well as the deficiencies in the incretin system. So, firstly, I think it's very logical to use combination therapy. The traditional approach of using monotherapies and then adding one at a time as you fail sets one up for failure. Treating early and aggressively addressing the multiple defects of diabetes leads to less chances of failure, particularly in clinical practice, where sometimes people go many years uncontrolled before another therapy is added on. But that's for glycemic control. We also need to think beyond that about other effects of medications that will reduce cardiovascular events and to understand the mechanisms behind that. So, for example, we know that insulin resistance is a fundamental abnormality for both diabetes and cardiovascular disease, and an insulin sensitizer like pioglitazone addresses many of the links between insulin resistance and cardiovascular events. Similarly, DPP-4 inhibitors like allogliptin have been shown to be very effective in maintaining longer-term glycemic control and work synergistically with insulin sensitizers like pioglitazone.
What has been your highlight of this particular symposium and why?
The highlight of the symposium is looking at the data from long-term clinical trials with the drugs that we have been talking about. So, for example, with pioglitazone, the data from the proactive trial was analyzed, and then other trials were designed based on what kind of patients responded best to pioglitazone therapy. So, in proactive, people who had a prior stroke and who were insulin resistant did very well, and those particular patients were chosen for the IRIS trial, which showed a tremendous outcome, leading to great reduction in cardiovascular events, particularly second stroke and MI in people with a prior stroke. Examine looked at people with recent acute coronary syndromes, people who normally do fairly badly in terms of outcomes, and showed that the drug was very safe. So this kind of data helps us prescribe therapies for diabetes with confidence.
And what do you think are the biggest challenges facing type 2 diabetes management?
There are many challenges in managing any chronic disease, such as diabetes. Patient compliance, taking adherence to therapy over many years can be problematic. Obesity and the fact that even with obesity drugs and bariatric surgery, some people remain obese and therefore insulin resistant and still have what we call residual risk, not getting all the risk factors down to where we would eliminate cardiovascular events in people with diabetes. Thank you.